Hi everyone, my name is Dr. Kim. I work here at the Mount Sinai Spine Center. Thank you for choosing Mount Sinai Spine for all your spine care needs.
Welcome, and thank you for choosing Mount Sinai Spine. My name is Mark Henry. I'm a physician assistant for Mount Sinai Spine.
My name is Lindley. I'm also a physician assistant for Mount Sinai Spine.
Today, we'll be guiding you through your Mount Sinai Spine preoperative patient education video. Welcome to Spine School. Today in the video, we will review what to expect before and during your hospital stay, physical therapy education, social work education, and nutritional education. Separately, you will have a one-on-one individual session with your physician assistant or surgeon's office. In that session, you will discuss your specific surgery. You will review your preoperative medical assessment, medical history, answer any additional questions you have, and review your post-op appointment date. Before getting to the hospital, your surgeon's office will provide you with a checklist of required preoperative tests and specialists to see. This may include simple blood work or more complex testing, such as evaluations with specialists. Each patient receives a customized plan. We do this to ensure that you and your body are medically optimized for your procedure. Optimized patients have the best outcomes, fastest recovery, and fewest complications. Ideally, you have already completed your preoperative medical assessment. My Next Steps. My Next Steps is a digital, interactive, and individualized care plan through the My Mount Sinai app. You will automatically be enrolled in the care plan that includes reminders, educational material, and surveys. My Next Steps enhances your understanding of the hospital process while providing valuable information to your surgeon. It gives you an opportunity to provide feedback to the hospital, doctors, and staff about your experience. Look for more details in your My Mount Sinai app starting 7 days before your procedure. What if I get sick before my surgery? While uncommon, patients may get sick just prior to their surgery. If you develop a cold, virus, sore throat, or other illness before your scheduled surgery, please contact your surgeon's office. Only they can determine if your procedure will need to be rescheduled. In preparation for your surgery, as previously mentioned, you will have already spoken with your primary care provider for a preoperative medical assessment. Specifically, there are some medications that need to be stopped weeks, 14 days before your procedure, and some that are 7 days before. This is new guidelines that are new to the hospital and new to many practices. The specific medications are listed here. Some medications will be permitted the morning of the surgery, while others will not. We will discuss this more during your one-to-one session. Smoking, alcohol, and drugs. For at least 72 hours prior to the surgery, please do not smoke, drink alcohol, or use recreational drugs. These may interfere with your anesthesia medications. A representative from Mount Sinai West will contact you the business day prior to your surgery to let you know what time to arrive for your surgery. Typically, you receive a call between 12 and 3 p.m. If you are in need of special accommodations due to transportation challenges, please contact the surgeon's office directly. The night before surgery, do not eat or drink anything after midnight. If you need to take medication, please do so with a small sip of water. Alcohol may not be consumed on the day of surgery for any patient. Patients taking GLP-1 inhibitors. 2 days prior to the procedure, only clear liquids should be consumed. Starting at midnight on the day of the procedure, no food or liquid should be consumed. Do not eat or drink anything after midnight. Your case may be canceled if you do not follow the above instructions. The day of surgery, what to bring. We've enclosed a checklist of common items that you should bring with you during your hospital stay. A government-issued ID, insurance card, list of medications and the dosing, prescription medications in their original pharmacy bottles. You may need to take your own medication while at the hospital. Speak with your surgeon's office for specifics. Prescription card and pharmacy name and phone number, list of your allergies, healthcare proxy information, emergency contact numbers, loose-fitting clothes, rubber-soled shoes that have a back, dentures and hearing aids, glasses, not contact lenses. The hospital does not provide lens care kits. phone numbers for all your physicians, family and friends you might need to contact, house keys, and a cell phone with your charger if you want. The day of surgery, what not to bring. Please do not bring valuables or electronic devices such as hair dryers and heating pans to the hospital. On the day of surgery, you will arrive at the hospital. Please arrive to the patient entrance for ambulatory surgery at 428 West 59th Street. It is located next to the emergency department entrance for Mount Sinai West. It is located on West 59th Street between 9th and 10th Avenues. Please arrive on time. Many patients are having surgery on the same day, and there may be a queue when you arrive. Typically, patients arrive 3 hours prior to their expected surgical time. This allows for any last-minute adjustments. This allows the nursing staff to review your case, and in some cases, your surgery may start earlier than scheduled. You'll be given a hospital gown to wear, and you have a hospital ID bracelet placed on your wrist. Immediately before the surgery, you'll be moved into a private room called Phase 2. Our staff will escort you to the private room. If you require a wheelchair, one will be provided. You'll be asked to verify your name and date of birth multiple times. This is for your safety. This is to ensure you are getting the correct treatment that is planned for you. You will meet with a member of the surgical team. This may be a physician assistant, nurse practitioner, or a fellow. You will meet with your surgeon. You will meet with the anesthesia team. You will be given time to ask questions and address concerns. You will sign your consent forms. Your operative site will be marked by a member of the surgical team. Anesthesia. An anesthesiologist will meet with you prior to your surgery to discuss how you will receive anesthesia and answer any questions you may have. An intravenous line will be placed in your arm to allow fluids and medications to be given to you so you are comfortable during the procedure. Please inform the anesthesiologist if you have any problems in the past with anesthesia. Please answer their questions honestly. It is important that they have an accurate information to provide you the best care.
After the surgery, you will be taken to the Post-Anesthesia Care Unit, or the PACU. This is a unit where you'll be closely monitored. Specially trained nurses, physicians, and other medical staff will take care of you. If needed, they will start administering pain medication right away. You will stay in the recovery room until you are more alert and medically stabilized. After you are medically stabilized, you will be discharged from the PACU unit. If you are being admitted, you will be taken to the appropriate unit. If you're going home, you'll be taken back to Phase 2. This is the area where you met the staff that morning. Please note that visitors are not allowed in the PACU except for special needs or pediatric patients. In the PACU, you'll be asked to rate the severity of your pain using a pain scale, 0 being no pain and 10 being the worst pain. There is no right or wrong answer. Just rate your pain as best that you can to give us an idea of how closely we are making you comfortable. Pain management. You'll be asked frequently about your pain. You'll be given several types of pain medication. Some will be scheduled, some can only be given if you ask for it. Please advise the nurse if your pain is not improving. Your surgeon will prescribe your personal pain management program, which will involve oral, intravenous medications, and/or the use of a pump that you will activate yourself. This is known as a PCA pump. Your nurse will instruct you on how to use the PCA pump. Always tell your doctor, nurse, or other medical staff when you are having pain. And don't be afraid to ask for pain medication. Some non-medical methods that you can use for pain relief are ice packs, which will be available from nursing staff, relaxation techniques, rest, deep breathing exercises, and proper positioning. If you are admitted after surgery, a member of the physical therapy team will see you within 24 hours. Physical therapy will educate you on the safest way to move about after your procedure. They will teach and review with you the exercises that you can continue at home. If you're admitted, a social worker will also be assigned to your case after surgery. If needed, the social worker will send referrals to an accepting home care agency to arrange for home care or placement to a rehab facility. Your social worker will discuss your specific arrangements with you prior to your discharge. Ask your surgeon at your follow-up appointment when it is appropriate to start outpatient physical therapy. Typically, you would start weeks after the procedure. To prevent blood clots, you should do your home exercises regularly, and you should walk every day. Walk for a maximum of 15 to 20 minutes at a time. If you cannot walk for 15 minutes, use this as a goal. You will be given sequential compression devices, or SCDs, at the hospital to wear around your legs. If you take anticoagulants or blood thinners prior to surgery, ask your surgeon when it is appropriate to resume these medications after surgery. To prevent infection, antibiotics will be given to you through your IV during surgery as a preventative measure. In most cases, you will not require additional antibiotics at home. Keep the area of your incision clean and dry. Do not shower until cleared to do so by your surgeon. Do not submerge the area of your incision in water or take a bath. If you have diabetes, it is important to keep your blood sugar under control. Call your diabetes doctor if you are having trouble maintaining normal blood sugar. Blood sugars may temporarily increase after surgery due to stress of the recovery. What to expect upon discharge. It is required to have someone accompany you home. Your medications will be sent to your pharmacy prior to discharge. These may include pain medications, spasm medications, nerve medications, a stool softener, and any additional medications as determined by your surgeon. If you require a walker, cane, or brace, please use as directed. Surgeon-specific discharge instructions will be given to you inside your preoperative packet. If you do not receive these instructions, please contact the surgeon's office. After returning home, you'll receive a call from the nursing staff and/or your care coordinator with detailed instructions for the continuation of your medications, wound care, exercises, and follow-up care. After your discharge from the hospital, you will receive a follow-up call from the surgical team within 72 hours. Continue doing your home exercises advised by your therapist. If you have any concerns while you're at home, please call your surgeon's office or home care agency. For an emergency, please call 911. Some reasons to call the office include noticing any redness, swelling, or discharge at the surgical site. Minimal drainage is expected, but if you see an increase or change, please call your surgeon. If you develop new or sudden weakness in your arm, hand, leg, or foot, if your temperature exceeds 101 degrees, if you have new calf pain or calf swelling, if you do not have a bowel movement for 5 or more days, call 911 if you develop chest pain or shortness of breath. Lifestyle changes. Our hope is for you to continue living a healthy lifestyle. Continue to exercise and walk daily. Use 15 minutes as a goal. Maintain a healthy weight and be mindful of your daily nutrition. Smoking cessation for a minimum of 12 weeks is necessary to promote healing. Lifelong is best. In conclusion, our goal is for you to have a safe and positive experience while in the care of the Mount Sinai West Hospital.
We hope this video has helped answer many of the questions you may have had about your surgery.
Please let us know if you have any additional questions or specific needs. Thank you for your attention.
Hello, my name is Dr. Daryl Brown, and I'm an assistant professor in the Department of Anesthesiology, Perioperative, and Pain Medicine. Today I'll touch briefly about pain management for spine surgery. There are 3 major phases of care as it pertains to pain: the preoperative phase, intraoperative phase, and postoperative phase. So we'll begin with the preoperative phase. In the preoperative phase, we would like you to complete a comprehensive pain assessment of your pain history, medications, and pre-existing conditions. This is usually obtained by your surgeon's team. This helps us as pain anesthesiologists understand your baseline of pain prior to surgery. If you're taking any chronic medications, such as opioids, it's very important for us to know about these medications in advance, as you may require higher medications in the operating room and after surgery. The second phase of care is our intraoperative phase. This is where anesthesiologists play a pivotal role in your care. We ensure you or your loved one is completely asleep during the entire procedure, and we meticulously monitor your vital signs. We treat any pain you have in the operating room with medications so that your body is comfortable and doesn't react to the stimulus of surgery. After surgery, we enter the postoperative phase. This is a critical time for pain management. After surgery, some pain is to be expected. It's normal to experience some pain at your incisions or musculoskeletal pain, such as muscle spasm, after surgery. In the postoperative phase, we as pain physicians utilize a multimodal medication regimen which helps control your pain. This can include opioid and non-opioid medications to help treat your pain. We balance keeping you comfortable and functional after surgery. Our goal is for you to feel comfortable enough to participate in physical therapy and help you regain your strength and function, and ultimately decrease your level of pain. In conclusion, pain management for spine surgery is multifaceted and spans the perioperative period. Our primary goal for you is to keep you comfortable and ensure your safety and well-being throughout your experience in the perioperative period.
Hi, my name is Casey McCavanagh. I'm a physical therapist here at Mount Sinai West.
Hi, I'm Kathleen Ramirez. I'm a senior occupational therapist at Mount Sinai West.
The rehab team can include physical therapists, occupational therapists, and/or physician's assistants, and members of this team will see you either the day of or the day after your surgery to initiate movement, increase your mobility, and assess your needs that you might need when you leave the hospital. The rehab team will tailor your treatment for your specific needs. They will work with you on common goals. These goals may include education of spinal precautions, which are no bending, lifting, or twisting, practice log roll techniques to get yourself in and out of bed, education of proper transfer techniques off of different surfaces like a chair, toilet, car, or tub, walk safely with an assistive device if needed, practice stairs if needed, education of home exercises within your spinal precautions, and education on how to perform your activities of daily living within your precautions safely. You will receive a handout with exercises you can perform while seated in a chair. These are the same that will be reviewed by your rehab team while in the hospital. Perform each of these exercises 10 times, 3 times a day while in the hospital and upon discharge. At discharge, it's best to have someone accompanying you home. Some home safety things to think about before your surgery. Have a pair of supportive slip-on sneakers available. Use a firm chair with armrests in your house. You can add pillows to low couches and chairs if necessary. Remove any clutter or throw rugs that might be in the way. If you have pets that roam around your home, consider having someone assist with them. Be careful when walking on different surfaces. And if recommended, use your durable medical equipment and/or assistive devices.
Physical therapy may recommend a walker or cane upon discharge. An occupational therapist will assess any further equipment for safety in the home. If you live alone, it is recommended you buy a hip kit and/or a raised toilet seat prior to your surgery, especially if you are extremely tall and have no supportive surfaces around your toilet. You can purchase these items without a prescription from online retailers or in a commercial pharmacy. Please be advised, if any additional equipment was recommended to be delivered to your home, it is your responsibility to follow up with the vendor. Upon discharge, think about safety in the kitchen by preparing meals ahead of time or having a plan for meal grocery delivery. Organize your kitchen to have items easily in reach to avoid bending or lifting and twisting. In the bedroom, tape down or remove cords from walkways to ensure a clear pathway in and out of the bedroom. Organize your clothes in drawers and closets to make them easier to reach. Make sure your bed is easily accessible and of adequate height. Raise low beds with bed risers to avoid bending if necessary. Make sure your lamps can be turned off and on easily, as well as having your charging cords for your devices in close reach from your bed or chair. In the bathroom, organize the shelves prior to surgery, making sure all frequently used items are easily accessible. Make sure that your bathroom doorway has clear access. Make sure you have a non-slip mat outside of your tub or walk-in shower. For safety, you might consider ordering pre-mentioned equipment on your own prior to surgery, such as the hip kit or raised toilet seat. While getting dressed, please take caution when placing feet into or out of pants and undergarments. All lower body dressing should be performed from the seated position, only standing up to pull up or down garments between knee and waist level. Button-up and zip-up shirts are the easiest to put on. Sweatpants or track pants are the easiest to put on for lower body.
Your responsibilities while you're in the hospital is to do your best when a therapist, either physical or occupational therapy, comes to see you. Try to perform your exercises in the chair at least 3 times throughout the day. Unless otherwise instructed, Work towards 15 minutes of walking. This basic exercise helps promote healing. We want your surgery to be a success and your recovery to go as smoothly as possible.
Hi, so I'm going to teach you how to do a log roll technique while maintaining spinal precautions. So what we're going to do, we're going to bend both knees, keep feet flat onto the bed. And what we're going to do, we're going to roll the lower body and the upper body as a whole. So we're going to roll to the side. Now what you're going to do is kick both legs off the edge of the bed and slowly push up using your right arm. Yes, good. And now what we're going to do is scoot forward till both feet are flattened to the floor. Okay. So to lie back down while maintaining spinal precautions, you're going to lie on your side and kick both feet flat onto the bed. Good. Same thing as getting out of the bed, you're going to roll as a whole, moving your upper and lower body. Now you could extend both legs out. And there you go. For this exercise, we're going to perform seated in a chair. What Casey's going to do is going to lift her toe up and heels up. And you're going to perform this 3 times a day, 10 times each. So it's toe to heel. Second exercise is we're going to extend the knee. So you're going to kick the knee out, extend, and back. And you're going to alternate this 3 times a day, 10 times each. Good. Third exercise we're going to do is going to do some shoulder exercises while maintaining spinal precautions. Casey's what she's going to do is raise her shoulder only up to shoulder level and down. Next exercise we're going to do is shoulder abduction. She's going to perform this exercise all the way only up to shoulder level. Okay. Next exercise, she's going to bend elbows only up to the shoulder. In order to perform lower body dressing, while maintaining spinal precaution, Casey's going to show you the figure 4 technique, taking on and off her sneakers. If you have trouble with this mobility, I would suggest purchasing a hip kit, which comes with a long-handled sponge, a dressing stick, a long-handled reacher, a long-handled shoe horn, and a sock aid. If you're extremely tall, and you don't have any supporting surfaces transferring on and off the toilet, I would suggest purchasing a raised toilet seat.
Hello, my name is Emily Sherlock and I'm a social work manager at Mount Sinai West. After your surgery, a social worker will work with you, your family, your doctors, and your therapist to formulate and execute a personalized discharge plan. There are daily rounds where your team will meet to discuss your progress, your needs, and your concerns. Once we have formulated a discharge plan, a social worker will speak with you about the recommendations for discharge. If you are recommended for home care services upon discharge, including home PT, nursing, or occupational therapy, a social worker will review these services with you. You will be provided a list of certified home health agencies, and a social worker will refer you to an agency in your area to determine if they can accept your insurance. The provision of these services is dependent on the agency's staffing availability and locating an agency that accepts your insurance. If your case is accepted for home care services, they will begin 24 to 48 hours after the agency confirms its availability. Once services are confirmed by the home care agency, a physical therapist will come to your home between 3 and 5 days a week. Complete duration of therapy is between 1 to 3 weeks post-surgery. Most patients have 2 weeks of in-home therapy. The goal of intensive therapy is to get you back to your normal life in your home faster. Subacute rehab is explored for those patients who would not be safe at home based on the evaluation of the team. This level of care consists of a few hours of therapy daily in a skilled nursing facility. The social worker will provide you with a list of rehab facilities in your area, and you will be referred to the facilities of your choice that are in network with your insurance. You can check out the list of skilled nursing facilities online at www.medicare.gov. When you have been accepted to a subacute rehab facility, the social worker will inform you of the accepting facility. Social work will collaborate with the team to obtain authorization from your insurance if it is needed. Social work will help facilitate your transfer once confirmed and authorized. At subacute rehab, you'll participate in 1.5 hours of PT daily, and an average day is about 2 weeks. The following services are not usually covered by your insurance, although we are able to arrange them if it's absolutely needed. Transportation from the hospital to home, in some instances transportation to the rehab center, and private nursing home attendant care. Each insurance plan is different, and we are happy to explore your individual plan's allowances with you post-surgery. And finally, we want you to get back to your old or new self quickly, safely, and comfortably. We are here to help, so please let the social worker know if you have any questions regarding your discharge plan. If you have any questions for social work prior to your surgery, please inform your orthopedic team, and they'll schedule you for a phone call with a social worker.
While it is our mission at Mount Sinai West to connect patients with the most convenient and dedicated certified home health agencies in the 5 boroughs, we have recently seen a decrease in availability of home physical therapists and less insurance coverage of post-op physical therapy in the home. Our institution is rallying behind the trend to go directly to outpatient physical therapy and not waste any time at all beginning the road to recovery. At the time you were booked for surgery, your surgeon may have provided you with an outpatient physical therapy referral in preparation for this transition. If not, please notify us and we will provide you with a script. We encourage you to take time prior to surgery to look for an outpatient physical therapy facility in your local community. Please reach out to the facility regarding insurance coverage. Thank you so much for your understanding.
Hi, my name is Elise. I'm one of the dietitians here at Mount Sinai West, and I'm going to be talking to you a little bit about some strategies to optimize your nutrition both before and after your surgery to get you back on your feet as soon as possible. So first we're going to talk about some strategies to get your body ready for the surgery from a nutrition perspective. It's going to be really important that we are fueling your body properly to prep in advance of the stress that the procedure is going to put on your body. It's going to be important to include protein 1 to 2 weeks before your surgery, making sure that you are including a protein at every meal and snack. So that can be from an animal source such as meat, eggs, chicken, poultry, fish, or it can also come from our plant-based sources such as tofu, nuts and seeds, as well as beans. It's really important to include protein because protein does provide building blocks for muscles, bones, and it does also strengthen your immune system by promoting the production of antibodies. Protein is going to allow you to be as strong as possible going into surgery. We do also want to make sure that you are stocking up on your fruits and vegetables prior to surgery. Our fruits and vegetables are a great source of various vitamins and minerals, including vitamin C, vitamin K, iron, and magnesium that are all going to be helpful both prior to and following your surgery. And vegetables and fruits also help to support a healthy immune system, promote regular blood sugar levels, and reduce overall inflammation. Typically, the darker the vegetable or fruit, the more nutrient dense it's going to be. Another thing that's going to be really important pre-operatively is going to be adequate hydration. Studies have shown that patients who are well hydrated prior to their procedure report overall less pain and nausea following the surgery. So we want to make sure that you're drinking at least 8 8-ounce glasses of water per day. And we do want to try to limit our consumption of foods that are going to cause increased stress on the body, such as sugar, alcohol, and caffeine. It's not to say that you can't have any, but we do want to make sure that we are trying to limit any excess stress and inflammation that can be put on the body prior to your procedure. This is also very important for our diabetic patients. We want to make sure that you're reducing any intake of sugar-sweetened beverages and excess sugar intake to help promote blood sugar control and reduce the risk of inflammation, infection, and increased wound healing following your procedure. So after your procedure, we want to make sure that we are fueling your body to get you back on your feet as quickly as you can. nutrition is going to be a really important part of that. So again, we're going to talk about some components that can help you get on your feet as quickly as possible. Protein, once again, is going to be really important. As we discussed, it promotes wound healing. It also helps to repair the damaged body tissues and keep your immune system strong. And it's going to come from those sources that we previously discussed, both animal and plant-based proteins. Vitamin C is also really important in the post-operative stage, as it helps to heal wounds as well as form collagen in bone, muscle, and skin. You can find this in a variety of fruits and vegetables, but primarily vitamin C is going to be found in those citrus fruits as well as strawberries, kiwi, potatoes, peppers, broccoli, and kale. One of the most common complications following surgery can be decreased appetite. It's very common in the post-operative phase, but that does not mean that our body does not need increased calories and protein. As a result, we want to make sure that if you are finding it difficult to eat your baseline portions of food, that we are utilizing some strategies to help combat that. Transitioning from 3 big meals a day to 5 to 6 small meals a day can be a strategy to help increase your overall intake of calories and protein. And including high-calorie, low-volume foods such as avocado, olive oil, dairy products, and nuts and seeds can also be very helpful when trying to increase your overall calorie and protein intake and pack a punch in each bite that you're eating. Another strategy to help combat decreased appetite is to drink your calories. So that can either be from a smoothie made at home that includes maybe your favorite nut butter, a fruit, vegetable, protein powder, as well as your milk of choice. And you can also find this in your pre-made nutrition drinks that you can find at a local drugstore, such as Ensure or Boost. Another strategy that can be helpful is working with a dietitian, both or either in or out of the hospital, on some ways that you can optimize your nutrition post-operatively. Constipation is another concern that comes up in the post-operative phase as a result of decreased movement and some of the pain medications, which are known to be constipating. In order to combat that, we want to make sure that you continue to stay adequately hydrated, drinking at least 2 liters of fluid a day, and we also want to make sure that you're including those high fiber foods at each meal. So that would come from your fruits, your vegetables, and your whole grains, which will also help to get you your vitamin and mineral requirements. Fiber, especially our insoluble fiber found in our nuts and seeds, as well as fruits with the skin on, and our leafy greens are going to be really helpful for maintaining normal bowel function. So those are some of the things we're going to want to include on a daily basis. And this is just highlighting a lot of the topics that we had discussed. We want to make sure that, again, you are staying adequately hydrated prior to your procedure, and that you're making sure that you're including a lot of fruits and vegetables that have both that fiber, vitamin, and mineral component to them. We want to make sure that you are eating enough in the post-operative phase and meeting those increased calorie and protein needs through smaller, more frequent meals, as well as protein-packed snacks. We do also want to make sure you're avoiding any excess stress on the body by continuing to limit our consumption of excess sugar, processed foods, and alcohol. And if you do find that you have any questions or you're concerned that your appetite has remained low in the post-operative phase, feel free to reach out to a dietitian to help. Thank you.